All right. So let's go ahead and get started. So today, many of you heard from Governor Abbott regarding his initial steps to rolling back the economy. Most of you have heard this phrase, rolling back the economy or restarting the economy or starting the economy. President Trump yesterday submitted his or published his guidelines to uh, restarting America again. And so, what I wanted to do was basically be able to provide some information regarding President Trump's guidelines, the three different phases once the specific protocols have been met, and then also what this first phase of rolling back Texas's economy means from Governor Abbott's document or executive order, and then how will we as a local municipality, even with the additional guidance from Travis County, how will we as a local municipality engage and operate based upon those different echelons of guidance, right? So first, I want to really talk about first is the guidelines opening up America's economy. Right here, it's a slide deck that's available on the web. Uh, Now it is. I think it got published today, that kind of goes into the same specifics as the actual guideline letter or announcement that I posted yesterday on Facebook. So, what it says here is basically three different things that need to occur. And so, it's a criteria, a preparedness, and then it's actually going into these three different phases. And as you can see, it's just kind of giving this overview of it, right? And basically, it's just talking about the criteria is always going to be based off of data driven conditions. Uh, from a regional or straight state approach, as you know, we're probably going to most likely go with a state approach as the local disasters are declared from a state, county, and local municipality. So I believe more so we would be going and following the same protocols as we have been since the beginning of this situation back in the middle of March. And with that, everything within the criterias must be satisfied before we can even start proceeding to the phases of opening. All right. And then basically these different phases of opening outlined specifically for individuals as well as employees. Okay. And so, what are these different types of gating criteria? And call it gating because it's a gate. Until you've satisfied it, you've met all the specifics, or you have the key to be able to open the gate and then go on to the next level, right, or to the next phase. And so, this is what I'm going to highlight right here, are the different types of the criteria. And so, it's three aspects. One are symptoms we're supposed to observe and analyze, cases, and then the status of hospitals. And here it says satisfied before proceeding to the phase of opening. And I'm gonna highlight two things here. There are two options that can be selected in evaluating under the symptoms, cases in hospitals. And I'm gonna highlight to you the one that's concerning, and I'm gonna highlight to you the one that I will be asking here within our local municipality for us to be making our decisions from, right? So as you can see, I have one highlighted in yellow. The highlighted in yellow part are the aspects that I do not want us to follow. Uh, and so here we go. So under symptoms, you have observing a downward trajectory of influenza-like illness reported within a 14-day period, right? For cases, a downward trajectory of documented cases within a 14-day period. And then hospitals is treating all patients without crisis care. All right. That is very, you're talking about almost what that says is a day to day analysis. Is it decreasing day to day over a 14-day period? Right. That is ideal. That is what I believe most people across the board, whether you've seen it in the news or the media, is one of the concerning factors of rolling back the economy without a vaccine available. Is how do you accurately and how do you proactively observe and monitor that cases are not giving false numbers? One day is low, next day is high, next day is low, next day is high. How do you make sure that when we start doing this rolling back, we are really being very careful? To me, this is key in observing a downward trajectory within a 14-day period. The other option that elected officials can be able to utilize is a downward trajectory uh, of cases reported within a 14-day period, right? Or a downward trajectory of tests as a percentage of total tests within a 14-day period, right? Or within hospitals, is robust testing program in place for at-risk healthcare workers, including emerging antibody testing. Now, if you heard what I just read, the latter two are more concerning for me, right? It is not equality and equity across the board. It's not taking care of everybody. You have under symptoms a downward trajectory within a 14-day period, or a downward trajectory of COVID-like uh, syndromatic cases reported within a 14-day period. The big difference there is one is influenza like illness, the other one is COVID like uh, syndromatic cases, right? Uh, what we have been finding out through data is most people that have influenza like symptoms also have COVID-19. Majority do. So it's kind of which one do you observe, which one do you go for? I would rather be on the safer side, right? I know you would rather us be on the safer side of anything that could be potentially always a tandem. If you have COVID-19, you most likely have influenza. If you had influenza, you most likely have COVID-19, right? It kind of goes with the same fact of do we say, you telling me your signs and your symptoms, so I tell you, you probably have it, go quarantine yourself at home without actually giving you the test and verifying, right? That's the alternative of observation here under the symptoms aspect. When it comes to cases, you're talking about a downward trajectory of documented cases within a 14-day period versus a downward trajectory of positive cases as a percentage of total cases within a 14-day period, right? So as one is you're taking a snapshot of just the 14 days, or are you taking a snapshot of a count for the whole time frame and doing a comparison of whether or not there's an actual decrease for that 14 days overall, or are you just going to do a percentage of that 14 days? The concern is if you just do a percentage of the 14 days, right, you could potentially have some spikes in the way it averages out for that percentage. Just because you had 1 or 2 days that didn't really have anything could be misleading in the overall percentage, right? It's just the same way for regular math. You have different ranges of numbers. Some are significantly higher than others, but once you average it out, you come out with a percentage, which the percentage could be misleading to the actual day-to-day data, right? Um, Same thing as for hospitals. You have the piece of doing treating all patients without crisis care, or and robust testing program in place for at-risk healthcare workers, including emerging antibody testing, right? So when you're talking about this, and one of the things we're going to make sure that we do as we start looking at rolling back our own economy is ensuring for symptoms that we're not only just looking at influenza-like illnesses over a 14-day period, but we're also looking, which is and the downward trajectory of COVID-like syndromatic cases, right? And then same thing for hospitals, making sure that we have treatment for all patients without crisis care, but also, as the key word here, and robust testing programs in place for our first line and frontline responders. And then the piece here that we're really going to have to have that conversation here internally with with our leaders within the municipality. Is this downward trajectory of documented cases over a 14-day period, or the percentage of the 14 days, right? But it also has a caveat that state and local officials may need to tailor the application of these criteria to local circumstances, right? And so we will be doing that. Just know that the guidelines, as normal, with a local disaster statement, with a county executive order, with a state executive order, is those are the minimum standards and guidelines. If we see there's a need to add to, we will. And no, when it comes back to rolling back this economy, we will. There's no ifs, ands, or buts about it, because what we do, and if there becomes another spike and it happens here within Manor, it's on us, right? And I take that very seriously. It's on us. So as you can see, that is the gating criteria. So as I continue to go through these three different phases, know that this gating criteria has to be met across the board each time before you go through the next phase. Okay, and so one of the things of core preparedness responsibilities, and we are starting to actually get these things implemented now. One of them is testing and contact tracing. And what you'll see, and while I'm wearing this shirt, community health champions, been talking over the last couple of days with CEO Jason Foyner of Community Care. Some of y'all have seen the post already in the news about them opening up uh, uh, round robin or mobile local testing sites. Manor will be kicking off its weekly, one time a week testing site here within Manor starting next week. More information will be coming out about that, as far as hours, as far as the setup, as far as uh, time frame, and if you end up being positive, what the measures will be, what will happen, what will occur, those types of things. And not happen in a negative sense, happen in a sense as far as being informed, and then trying to figure out from you who else you may have come into contact so they can be tested as well. Okay. um, but the testing is still the same way. Nothing has changed as far as you having to get the approval, or do the telehealth aspect and get the approval to do the testing, right? Those things are still in place. But just know we are starting to meet the testing and contact tracing criteria that will start beginning of next week. For 1 day per week, we're also looking at other options and opportunities to be able to increase that through public-private partnerships. Another thing on here says healthcare system capacity, which basically means having enough PPE, personal protective equipment, to be able to handle dramatic surges in case there needs to be some. That is something else we've been talking about for the last week, between Dr. Karen Smith, myself, uh, Councilwoman Natasha Harper, Councilman Rudy Mateer, County Commissioner Jeffrey Trevelyan, Mr. Larry Wallace Sr., Quincy Dunlap from the Austin Area Urban League, talking with and other organizations. There's several conversations going on and trying to figure out how to be able to identify and obtain PPE equipment. Our goal here, unlike any of the other task force that we have, the food, the volunteer, the faith-based, the social messaging, uh, Manor is the center of the whole Eastern Crescent in understanding the role we can play as far as taking care of other underserved, underrepresented individuals like ourselves is key and crucial. We are looking at the health task force, and having asked Dr. Karen Smith, along with Jason Foyner, the CEO for Community Care, and others, to be able to say, we, the city of Manor, wants to make sure the Eastern Crescent is taken care of as far as testing, as far as the antibiotic testing, as far as anything that can happen regarding PPE. We are basically the most central point of access to the Eastern Crescent, to getting PPE out to our adjacent partners that may need it. So we're looking at ways that the city of Manor can help fill that void, and make sure we're not just taking care of ourselves, but we're taking care of our partners. we're taking care of the people to the left and to our right, right? Um, and then here it says plans. Plans as far as what are the protective measures for infrastructure? What are the protective measures for our first line for our first responders, for our frontline employees? City Council at our last meeting, I think not the last one, but the one before that, 2 meetings ago, actually approved a program to be able to support and take care of our municipal first line and first responders that may end up coming in contact with COVID-19 or may be presumed to have COVID-19. We are asking them to be out there on that front line. We're asking them to put themselves in that position to potentially get exposed to that virus. So we have made a determination to be able to take care of them. So we are allocating some funds specifically for them if we have to house them in hotels for food, meals, so they are not, basically housed with their family members and so forth, and potentially putting them in jeopardy because we asked them to be on that front line. We told them that they were essential personnel that needed to be on that front line, right? That is the right thing to do as a city, as a city council, and as your mayor. So we are moving forward to meeting these core responsibilities, as I just stated. We will continue to move forward and make sure that we have those established. And so now getting into the different phases, right? That President Trump put out here. So basically, first it says phase one, you have to satisfy all that criteria I just told you about, right? And once you establish that criteria, I'm just going to highlight the significant changes between where we're at right now with kind of the stay home, stay safe, with what phase one looks like. Phase one would look back to no more than 10 individuals gathering at any location. It would look at minimum non essential travel, right? And then still encouraging telework and the remaining closure of common areas. Uh, some things as such as schools would still be closed. Senior living facilities would still be closed. However, large venues such as sit down dining, movie theaters, sport venues, and if you're watching the news, you've seen in I think it was Florida, I forget which state it was, are now starting to do sports again with no audience, right? The WWE as well. So large venues could be able to begin again. However, under strict physical distancing protocols, uh, only outpatient elective surgeries would be open to be able to do, and gyms under phase one would be able to open back up with strict physical distancing and sanitation protocols, right? But remember again, phase one, all of those things to be able to become available, we would have to meet all that gating criteria first, and we are still at a significant way away from being able to be at that gating criteria, right? So just know, even though there's that going on with phase one, we still have a ways to go to even be able to get to the gating criteria to even think about the viability of phase one. Now, the difference between phase one and phase two is, once again, looking back again, enhancing the gating criteria to be able to now reopen things for this more less restrictive phase, which is phase two. And basically it says there has to be no evidence of a rebound and have to satisfy the gating criteria 2 times, right? And so the second time of having to meet the gating criteria is based off of the new the new things that would be open and available to do, which is now no less than 50 people. I mean, no more than 50 people. Non-essential travel would be able to resume, and schools and organized youth activities would open back up. would be able to open back up. Outpatient and inpatient surgeries would be available, and bars would be able to open back up with significantly diminished standing room occupancy availability, right? And so that's the difference between phase one and phase two, right? So then now it comes to phase three. Phase three is now relooking again at all the gating criteria I initially talked about and seeing how that gating criteria would meet the safety protocols for now going into this phase three. This phase three is once again only with no evidence of a rebound and that satisfy the gating criteria a third time. And so this third time now is basically you know no true restrictions on numbers of gathering. Only this identification that vulnerable individuals should not be in public interaction. There is no restricted staffing within the workplace. Facilities for seniors in hospitals visiting can resume, and then bars are able to increase their standing room occupancy, right? And what they say here, as far as outlined here, as far as vulnerable individuals or the elderly, individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune system is compromised, such as by chemotherapy for cancer and other conditions requiring such therapy, right? So I say all that, and I don't want any of you to uh, think we're going into a phase one, a phase two, or a phase three, right? We have to meet the initial criteria first. We're still far away off of meeting that criteria, but we're getting there slowly. There are certain things that is going to take longer for us as a city to meet that criteria, right? Because we are dependent upon a lot of regional services and support systems. So just know that as other cities may begin to do this reopening process, we are going to do our reopening process based on what we feasibly can do based on meeting the gating criteria. Okay, so let's keep that in mind. Just because everybody else is doing it doesn't mean we're going to be able to do it, because we have to be able to monitor and make sure we mitigate potential spikes before we have to shut everything back down and we're back into this stay home, stay safe criteria situation all over again, right? So now you saw Governor Abbott talked, I forget what time he talked today, I think it was about noon or so, regarding his executive order. And his executive order is kind of an interim between where we are now and getting to phase one, right? Uh, the only difference that his new executive order is doing is all the essential services, essential businesses that are operating right now, he's affording the opportunity for other businesses to operate like essential services. So let me get into that real quick. So Executive Order GA16. This one right here. Uh, I think I shared it today, and it's basically says relating to the safe, strategic reopening of select services as the first step to open Texas in response to the COVID-19 disaster. So I'm going to be reading from page 3 and page 4. And so page 3, down in the middle, talks about reopen services and what they shall consist of, right? So reopening services shall consist of starting at 12:01 a.m. on Friday, April 24th, 2020. And the reason I'm doing this Facebook Live message is because I want to afford every business that we have within the city of Manor to be able to meet these criteria, have as much time as possible to adjust their operations to be able to meet these criteria to be able to take advantage of this new executive order, right? So again, this reopened services starting 12:01 a.m. on Friday, April 24th, 2020 for retail services that are not essential services, right? but that may be provided through pickup, delivery, by mail, or delivery to the customer's doorstep in strict compliance with the terms required by the Health and Human Services, right? And it says here, such additional services as may be enumerated by future executive orders or proclamation by the governor. I'll go into a little bit more about that. Had a conference call, mayors and county judges, today at 3 o'clock, 3 to 4:30, no, 3 to 4, with the governor, and he kind of went into more detail about his executive order. So I'll give you some of the information that he provided there. And basically, it says here, for businesses, especially like churches, even though it's talking about reopening of essential services, um, and churches provide essential services, still telework and still meeting the minimal number of personnel. Nothing changes for you all whatsoever. Nothing changes. The only thing that changes is if you're a hardware store, if you provide some type of essential service that was already kind of listed before, now you have the opportunity to be able to provide your services as long as there's no employee contact. All purchasing and so forth being done online. Individuals able to drive up to your store, be able to have those items dropped off at the front door, and then they come to pick them up. They hop back in their car and they go home, or you drop it off in their trunk, like we do with the Central Texas Food Bank food delivery. Right? It's just now offering a little bit more opportunity for some businesses that were restricted before to now be able to find ways to streamline their operations, and allow you all to hopefully be able to start back up your business and be able to make some money and some profit to be able to keep those doors open. Uh, it says here, in accordance with the guidelines from the president and the CDC, people shall avoid eating or drinking in the bars, restaurants, and food courts, or visiting gyms, massage establishments, tattoo studios, piercing studios, cosmetology, salons, uh, provided, however, that the use of drive-through, pickup, or delivery options for food and drinks is allowed and highly encouraged throughout the limited duration of this executive order. So we have again, libation station, right? Libation station, do the orders, drop it off, pick it up, drive through, right? They can be able to do that. I know before we had was it Buddies? I believe the vaping store. Uh, if you're able to streamline everything online and do some type of drop off, pickup, whatever, right? You may be able to meet the criteria under this new executive order, which was specifically for stores that provided majority groceries as well as other items, right? So please take a look at the new executive order GA16 by the governor and make sure you read through it thoroughly and make sure you figure out what you need to do so when Friday the 24th comes, you hopefully can be able to take advantage of this opportunity, right? Uh, state parks will be reopened again. The governor basically stated that he hopes what people will take advantage of the state parks being back open, but they know that with the flowers and stuff there to take the proper precautions because you may be sneezing a lot, just given the different environment. And then uh, same thing. There's still restrictions on visiting nursing homes. You already know that the schools are going to be closed for the school year. However, uh, online studying is still occurring. So please continue to push that. We want to make sure our kids are as less far off as possible, right? And again, let me kind of speak real quick about some of the information that the governor spoke about when we're on his call. So he called this new executive order this retail to go. So it's open. This opportunity is open to all businesses based on minimal to no physical engagement. Drive up or drop off, online payment and transactions, right? So If you can streamline your business, if you can make sure there's no engagement that's going to be going on between you and someone else, right? And you can also still identify that it's essential, then you may be able to operate your business under the new executive order. Okay. Um, Also, even though this new executive order takes effect at 12:01 a.m. on April 24th, there will be subsequent executive orders coming out starting April 27th in anticipation of more rolling back of the economy or opening of the economy in May. Should be about 10 more different variations of executive orders giving more clarity, more guidance on businesses and what they can be able to do to open up their businesses, right? And just know though, this is also contingent upon cases in the COVID situation decreasing. That trajectory I told you about at the beginning, right? From President Trump's guidelines. As long as the trajectory is going down and decreasing, as long as the the uh, the health, the testing, and all those things are increasing as they need to, then we will start to see more reopening, more executive orders coming out telling businesses what other things they can be able to add on and start to do to continue to increase their operations and revenue streams. Um, he did say that as of right now, Texas looks close to leveling off. However, that's premature data, and based off of this premature data is where this new executive order is coming from. Is based on the information looks as if it's tapering off and it's starting to decline. Right. Uh, there was a question regarding for some people about property relief, and unfortunately, property relief only uh, is only available to actual physical damage. So because of this COVID-19 pandemic is not a physical damaging thing, unfortunately, you would not be able to submit for property relief. And definitely they're looking at how to try to reopen barbershops, nail places, spas. But right now they have not been able to identify a way to reopen these places or these businesses that would be safe. So still more to follow. There'll be more guidance being put out, but I wanted you all to know, I know I posted it before, but definitely if you own a business here within the city of Manor, or if you're tuning in from for another city, make sure you read Governor Abbott's executive order number 16 so you can start planning now while you have, basically 7 days to try to restream and revamp and revise your operating procedures to mitigate any employee engagement and to identify where within CDC guidance and the CISA essential services list you may align with so you can take advantage of this new executive order. All right. And then with that, I'm going to go ahead and take a look at what some of these comments are and see if I can try to respond to some real quick. See here. No one knows the true data. You are correct. No one knows the true data. And I'll be very honest and blunt. We do not know the true data because this is a self-identification and a self type of quarantine situation. If individuals do not identify, if individuals at least inform their local municipalities and say, I'm self quarantined or I was told to self quarantine or whatever it may be, then we can be able to have better data. But because this is an asymptomatic situation, there's this window of possibly having it. If people do not inform and say, I think I might have it, I'm having these symptoms, I'm not able to go get tested, but I think I have it, I'm self quarantining, right? I'd rather have false data that says the numbers are too large than what we are all concerned about that the numbers are too low, right? So definitely with you and understand that. And it says, what businesses still need reusable masks in Manor? Uh, basically, if you're not a first responder or you're not a frontline worker or within the healthcare spaces, you're not supposed to be all the N95s, N99s. Those masks are really focused for and supposed to be dedicated to those essential workers that we are putting on the front line. So continue to wear the handkerchiefs, continue to wear the regular mask and the cloths and everything that you have, and that's going to continue to be in effect until rescinded. And then see here, and someone said, can we get gates put in around shadow-willing entrances for isolation purposes? I will tell you this: that is an HOA decision in the sense of if you all decide that you want to do that, you submit that for it to get approved, and that's the way it has to happen. HOAs make their own determination on how they want to operate. Once y'all decide and vote on what you want to do, then you would submit the request and the paperwork to the proper authorities for them to review and either approve or deny. I will say this: I do not know how long that would take to get some gates up, but I know it's probably not an overnight thing. So please do keep that in mind. But if that's something that you all want to do, I recommend doing maybe an emergency meeting so y'all can start having that conversation now. Uh, says, are elevator technicians included in essential services? Uh, I do not know fully if they are or not, and I do not want to make an assumption, a false assumption, and tell you they are and they may not be. All I can do is tell you to go to the CISA essential workers and businesses list and look in there and identify and find out. Right, that thing is long and it's very detailed, and it will tell you if they are or if they are not. Okay. Um, let's see here. That will include the COVID-19 crisis response volunteers, also uh, Monique Seldon and crew their front line. So the program order is for municipal, the municipal first line responders and the city hall staff. As far as those that are working with the COVID-19 task force and so forth, right? Individuals like myself, right? I'm not covered. That is something that we're doing for our paid employees. That is basically you have to be there, or worst case scenario, you have to be there or you're fired, right? There's a difference between that and volunteering to be there. I know what I just said probably stinks. I know what I probably just said is not fair, but I'm not covered in it either. Neither are the city council members. Uh, we are all volunteering. We are all electing to put ourselves on the front line. So that is kind of the difference. Same thing with our medical professionals, medical profession, EMTs, EMS, and so forth. Right? We're basically telling them to go do their job or be fired. Essentially, just being straightforward and blunt. Let's see here. Yes, we still have to wear face masks. Nothing has changed with that. I would still say for face masks, the nose and the mouth process, still look at the county order, which tells you what to do in that regards. And kind of to go back to the Governor Abbott's executive order, it says that this executive order shall supersede any conflicting order issued by local officials in response to the COVID-19 disaster, but only to the extent that such a local order restricts essential services or reopens services allowed by this executive order or allows gatherings prohibited by this executive order, right? So the nose and the nose and the mouth mask do not conflict with this new executive order by the governor. Um, it says, will Manor get a medical truck outside set up for COVID-19 testing somewhere? We do have a location identified for local testing once a week for a day with community care. Again, community care. more information will come as to what day that is, the hours, the process for it, and what you need to do to be able to get tested if you believe you need to be tested, right? Let's see here. Uh, a question about, does this open up hair salons in Travis County? I know, right? I have my wife is modifying with the hair wrap like a lot of other people are. Unfortunately, when you're talking about cutting someone's hair, you're talking about doing someone's nails and all that stuff. That is close physical contact, right? It's non-essential, and so until we can identify ways to be able to do that, and even the governor basically asked and said, "Hey, if any of the mayors and county judges can identify a way to make it happen, to let them know, because they're still trying to figure a way with that type of even your hair, your skin, follicles, all that type of stuff, right? That's even a little bit more cross contamination than just touching a tabletop and then leaving, and then someone else coming right behind you and touching a tabletop, right? That's more than just droplets. So we have no clue, we have no idea. We're still trying to figure that one out. He's still trying to figure that one out too. Let's see here. It says, do we know how many cases of COVID we have here in Manor? The last time I looked, I think it was a couple of days ago. We had about 13 identified. You can go onto the Travis County website. They have a dashboard that they update every day, and it actually gives a breakdown by zip code, by area, of how many cases have been identified. Again, that number is misleading though. As I said before, the cases are a total number of cases that have happened since the beginning of this pandemic, right? Now you start to see a recovery number. So you have to subtract that, you can't really even subtract that recovery number from the actual total number of cases. But those cases that they're reporting are the ones that have actually been tested, and the information has been documented, right? That's not counting the individuals that have not gone tested, or the individuals that have been told to stay home and self quarantine, okay? So again, that number helps, but the number is not the greatest number to go off of either. Let's see here. All right. So it looks like I've answered all the questions that have been presented. Hopefully, this information was beneficial for you all, especially to our business owners, our local small business owners. So please definitely look at Governor Abbott's executive order, GA. Look, I'm forgetting the number of it. GA 16, and make sure you adhere to it so we can see your business back up and running. Uh, uh, as 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 best as possible. All right. Thank you, and y'all have a great weekend. And looking forward to sharing more information with you on our local testing efforts, and hopefully in the near future be able to announce to you that we have been able to establish PPE facilities here within the city of Manor. No, those are the two things that we're very focused in on right now. Monique Celadon is doing, and her team is doing an outstanding job with the donations and with the food stuff. Uh, we should have a nonprofit called the Manor Emergency Management Foundation established. So all contributions and things that are being sent in will go to that, which would be a City of Manor foundation account for any future emergency planning needs and efforts, right? We want to make sure that any funds, any money that is raised up, and for whatever reason is not used or expended, can be on retain for any future things that may come up, right? We are learning through this situation that there are things we need to put in place, not just for now, but for anything that may happen in the future like this, so we can be a whole lot quicker in getting things put together and aligned to be able to take care of the community. The biggest thing with your funding and your assistance that helps this city to be able to do, we don't have that much of leeway in being able uh, we're somewhat restricted with the budget that we have. Uh, to be able to do some of the things we believe we're going to have to do in the future throughout this pandemic. And y'all support, y'all's donation of food, y'all's donation of free time, y'all's donation of even money is helping to make sure the city is able to continue some of its critical infrastructure, some of its critical development with wastewater and so forth to meet the uh, current population and more, uh, while not having to stop some of that to try to figure out how to fill some of the essential needs. Because when that time comes, and we're hoping that time doesn't come anytime soon, when that time comes, uh, that's really where the city is going to have to make some very serious decisions where, um, you know, how do we help the community, but we also keep our first responder and frontline workers in place that are needed? How do we take care of the community but still continue to build out wastewater and water and other things? How do we take care of the community and still be able to do some of the additional things that need to be done as once this pandemic is over, the city is not in a serious debt that it will not be able to come back from. So I appreciate all your support. I appreciate everything that you are doing. I appreciate all the volunteers that are coming online and helping out every day. Please continue to stay Manor strong, and we will all get through this by working together. And I pledge to keep you all as informed and abreast of things as best as possible. Thank you.